Kia ora, I'm Dr. Helen Fulcher and I'm speaking with Dr. Lily Fraser, who's a general practitioner, and we're speaking about Māori health. Hi Lily. Now Lily, you work in a Māori health centre, and can you give us some tips about engaging with our Māori patients?
Yeah, sure. So I work at Turuki Healthcare, which is in Māngere, and half our patients are Māori and the other half are from the Pacific. And I also do work with the University of Auckland, teaching medical students around communication skills with Māori patients. And we use a framework called the Hui process. So it's something that all medical students in New Zealand are now taught, whether they're at Otago or Auckland, and it was developed out of Otago. So it's something that we are hoping that general practitioners can take up, so that when students come into our practice, they can see it modelled, because we have kind of talked to the students about, you may not see this modelled in your seniors. But also because the evaluation of it, Otago did a qualitative review of this framework, and Māori patients found that their consultation was much better experience when the Hui process was used. So, I mean, the core part of the consultation is the same. So we're still taking a history and doing all those things, but the real fundamental difference is right at the beginning. We're really bringing that identity, a sense of identity that Māori have. So, if I meet another Māori person for the first time, in that greeting we'll be talking about where are you from, and that's usually talked about in an iwi sense. So, I'm from Ngāi Tahu, they might be from somewhere, we make a connection, we may know the same people or somebody, and that really is the beginning of the relationship, and then the other things fall out of that. And so what we're trying to do is trying to provide a framework that you can incorporate that into your consultation. And so the kind of standard way that we do things in primary care is kind of, a high, superficial kind of rapport building, like, it's raining out there or something, and then we dive straight into what brings you in today. And so what this framework allows you to do, or encourages you to do, is to take a step back and say, okay, this person that I've never met before is sitting in front of me, and I want to make this Māori way of connecting with them.
There's a lot more to them than just the raining outside.
And so the framework needed to be safe for all Māori, because as you know, everybody is different, and the experience of being Māori in New Zealand is different for every single Māori person. And so for some people, like myself, I'm fluent in Māori, I've been to my marae, I identify strongly with the Māori community in my day-to-day life. Whereas, you may have the other end of the spectrum, somebody who's been adopted, or has been living on the streets, or doesn't have that connection to even name their marae, their tribe. So we want this to be something that you can use with any Māori person, and they will interpret it in a way that feels right and safe for them. So often it is around somebody's sense of place. And so we really, the word that we're looking at really is, where are you from? And you might go, I'm from Māngere. Okay, how long have you been living in Māngere? And it might be that they've grown up there, like, is your whānau from Māngere? You're either going to get yes, and you can leave it there, or it might be no. My grandfather came to Māngere, but we're originally from da 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 da. And so you get this little story around putting somebody in their context. And it may be that they've recently moved from where they're from, and that really impacts on the way that their life is right now. So that's what it is. And then the part that's, we often do elements of that in our history, like we find out their social context, but this involves reciprocity, or how do you say it? Which is, that you are sharing something of yourself. And I think as doctors...
that can be tricky.
Well, I think some of us have been taught not to do that. Now, some of us naturally do it because we like to talk about our children, or we like, we think that there is value in this being a two-way relationship, which of course there is. But some of us have really had that old school of, I am just a resource to you, and I'm not a person. And so we are trying to break some of that down. Because we want this to be equal, and it's just creating some kind of common ground. And so we encourage all doctors, no matter where you're from, or where you've grown up in the world or in New Zealand, to just take a moment and think about what is it that you're comfortable sharing with patients.
Because it needs to be safe for the doctor as well, doesn't it?
But it should be kind of equally important. It's like,
That's right.
on par.
Yeah.
So it may be, if I say I'm from Ngaitahu, and you may say, well, I went to Otago University and I've been past your marae, or, I really like Dunedin, but I grew up in Auckland around this community. And, we're also the patient is getting this idea of you and your sense of place.
Yeah.
So, for some people that's really easy. And for other people it's quite a foreign concept. Why would you even want to know that?
Yeah, yeah.
But that's really how we communicate with each other. When you go to any hui, we're always going around and it's really about making those tribal connections and it's really just joining the dots of I know your third cousin. That kind of. Yeah.
And I think sometimes we do that with colleagues, but we don't as easily do it with patients.
Yeah, definitely. Yeah, and so that's one of the aspects of the hui process. In GP, I think I'd like to think that our ethnicity data collection is really good.
Yeah.
That we are getting the patients to fill out their own forms and they are self-identifying their ethnicity. But I still think there are a lot of practices that probably need to look at their process because it may be that they've been doing the same thing for a long time.
Yeah.
And so looking at how that data is collected, because, this is designed for Māori.
Yeah.
We had a question before around, can you use it for non-Māori? Well, of course you can, but it's been designed for Māori and it's been evaluated in Māori.
Yeah.
My gut is it's probably fine for everybody, but we actually just haven't.
Yeah, hasn't been looked at.
It hasn't been looked at.
Yeah.
So I think there is, looking at your ethnicity data collection, checking that you've got it correct, and how are you reviewing that?
Yeah.
And that sometimes can be a note that says, I see your ethnicity here says you're Māori. Is that correct? Yes. Oh, where are you from?
Yes.
So it kind of
opens
up that that door as well. So I think those are the key things.
We talk about, you've mentioned how that's being taught to medical students now, which is wonderful. But for those of us who have gone before and haven't learned this, is there a way of learning this as postgrads, as people working at the coalface now who are interested?
Yeah, I mean, it's often is taught at conferences. I know that the college conference often has one on consultation with Māori.
Are there online resources?
There's a paper. I'm not actually sure is the honest answer. It's not my process, but Otago University developed it. And so if you look up the hui process online, there is definitely a paper.
Perfect.
And there may be a
We'll have a look. And any other tips then? So we've started off with this increased level of engagement, hopefully, where you've shared something and you've hopefully managed to ask your patient to share with you. And then during your consult?
So we talk about use of Māori language, and we feel like, this is research that Otago is still doing around, there are a small number of Māori words that all New Zealanders know.
Yes.
And so kia ora, definitely as a greeting, we feel that can universally be used for any person.
Yes.
And then within that, there are other words like whānau. We talked about as mimi one. Puku. There are words that most people, even if they don't speak Māori people, if they don't speak Māori, they would still feel comfortable having those words used.
Yes.
So getting to know those, and Otago, or the Mihi unit, have made a resource called Aki Hauora, and it's basically a language app looking at pronunciation of Māori words.
Wonderful.
And looking at increasing your vocabulary.
Yes.
But, I don't think it should be underestimated, the power of pronouncing someone's name correctly. And so I think if you're looking at where do I want to focus my efforts in terms of Reo, then I think pronunciation is really where people should be working on, because I still often have people say to me, you're the first doctor that's pronounced my name properly. And, I think there are some really long, beautiful, meaningful Māori names that get absolutely butchered.
I was going to say, I imagine.
And so, if you don't really already have that knowledge, then please talk to the patient. Say, how do you pronounce your name? And then write your little alert phonetically. So, it's okay to do that. When I have non-Māori patients who have a name that I've never, I phonetically put them out, so the next time I'm not going to do the same thing.
Yeah, that's right.
So I think those are little tips. But if Māori words are used in consultation, then, say the word back, I don't know, for example, if you, mamai, and you don't know what mamai means, you say mamai, just reflect it back and just indicate that you didn't quite get that, and they will tell you what it means.
So don't worry and brush over it and feeling like you're going to insult them by asking. Be ready to learn.
Yeah, be ready to learn.
Yeah.
So I think that's, those are just in terms of things that you can do.
Yeah.
Coming back to the medical students, because I think, there's a generation of doctors coming through that have been taught Māori health in a way that we weren't. And a lot of hard work has gone into developing the curriculum in both universities. And so there is, if you have medical students, there is a Māori hauora or hauora Māori question, that has 3 elements to it. And I have heard from a number of sources that often that's just not marked. So people just see either not observed or, I don't feel competent to assess that, so I'm just not going to even ask. And I just challenge the teachers out there to delve into it. The competency is written there. Just read the competency out and see what you get back, because actually we will all learn from the medical students. The responses that I get, the articulation of their role in the health system and the power that they hold to be able to change the course of somebody's health is really well understood. And so I think that we should challenge ourselves to actually delve into that, and rather than saying not observe, well, of course you didn't observe it, because a lot of it's internal, and it is looking at what are their attitudes, what are their what's their understanding of the role that they play in the health system, and then the bigger structural things in the health system that mean that at the moment Māori have much poorer outcomes than Pākehā. So, or non-Māori.
Oh, look, Lily, that's fantastic. Thank you. Some really great tips there. Practical things for us to start trying, and also places to look for further education. So thank you. Look forward to seeing you speak more.
Cool. Thank you.
Thanks, Lily.